Okay, I see that we are at 11:15 and I see Jasmine's here. Jasmine, I'll go ahead and hand it over to you to run your session.
Thank you so much. So my name is Jasmine Leonard, and I'm going to be presenting on building on cultural competence applications of cultural responsiveness. So our agenda today is to go over some foundational knowledge, to understand cultural responsiveness, and then to have some recommended next steps, followed by a Q&A. So the objectives are to recognize the significance of cultural responsiveness in healthcare delivery, identify strategies for effectively integrating cultural considerations into patient interactions and decision-making processes, enhance communication skills to facilitate culturally sensitive interactions with patients from diverse backgrounds, and to discuss the role of cultural responsiveness in fostering respectful and collaborative relationships with patients in communities. So if you join me, I have no financial disclosures or conflicts of interest with the presented material in this presentation. All right, now the fun stuff. So at Care First, we've been talking about the existence of equality and equity and health inequities since the pandemic. And our CEO has said that this work has just begun. We cannot accept this reality. We can do more. We must embrace the need to change, each of us individually and collectively as a society. And here you'll see that I have two photos, one that is depicting equality and one that is depicting equity. As we talk about the health inequities and talk about the need to strive towards health equity, I want to make it clear that equality and equity are not the same thing. Equality is when everyone gets the same regardless of what's needed or what's right for them, whereas equity, and you can see in the photo to the right, that everyone gets what they need, understanding the barriers, circumstances, and conditions. So if you were with me last year, you remember that I like to start out with definitions because I think that it's important that we all get on the same train of thought. And so what I have next are some definitions. And so if you can put in the chat what you think these definitions are. We'll go through, I think, 6 words and hopefully get some foundational knowledge. All right, so how do we define culture? And feel free to put your answers in the chat so that we can see what we think culture is. Shared assumptions and beliefs, people's history and experiences that make them who they are, traditions surrounding death, traditions, beliefs and values, shared norms, traditions, values, a person's customs, morals and standards, beliefs, customs, and traditions. Yep, so that is culture. So culture is defined as integrated patterns of human behavior that include the language, thought, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. Yep, great job. All right, so our next word is race. A group of people who share physical characteristics such as skin, color, and facial features. Biological. Any other takes at what race is? Competing. Okay, yes. So genetical disposition, skin color, identity. Okay, so race is actually a socially constructed system of categorizing humans largely based on observable physical features, i.e. phenotypes, such as skin color and ancestry. So the biggest point here is that it's a socially constructed system of categorizing humans. So it's not going to be something that genetically is a disposition to say that you are this race. It is a social construct, and that's why it changes when we go into different areas or different cultures or different places. Not everyone has the same structures of race. You can think about, like in South Africa, they define race as very different words than we do here in America. But so a socially constructed system is the important takeaway with race. What about ethnicity? Same cultural background, genetic background, same religion, group of people that share the same culture, religion, culture, yes. So ethnicity is a grouping of people who identify with each other on the basis of shared attributes that distinguish them from other groups, such as a common set of traditions, ancestry, language, history, society, culture, nation, religion, or social treatment within their residing area. So all the things that you all mentioned. All right, so this might be a little bit harder, but if you were here last year, hopefully you remember what cultural competence is. No takers for cultural competence? No guesses and wrong guess. Being conscious of our differences, interact with people, understanding others' beliefs, being able to understand and navigate cultural differences, awareness of other cultures, understanding other people's cultures and respecting them. Yep, knowledge of others' cultures. Yes, being able to understand and respect, ability to provide care to multiple demographics effectively and respectively, constantly learning and respecting the differences everyone has. Yes, so it seems that you all remember things from last year, which is I'm very happy about. Being sensitive to own biases. Yes, yes. So the definition for cultural competence that I use is a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. But yes, all the things that you all said. So then the last one is cultural humility. So it's somewhat tied to cultural competence, but there's just one distinguishing factor for cultural humility. The ability to learn about what is important to them about their cultural beliefs. Being respectful of other beings, yes, or other beliefs, yes. Being conscious of your own beliefs, yes. Recognize, honoring to their beliefs, recognition that you do not have the answers, being open to continuous learning about others' cultures and backgrounds, being willing to learn from others, respect, appreciating the differences in cultures, having empathy of another culture, keeping an open mind. Yes, all of that. So cultural humility is the ability to reflect and critique one's own ability to learn and understand someone else's culture and beliefs. So now that we have the same foundational knowledge, I think it's time for us to understand a little bit about cultural responsiveness. And I want to set the stage for what we have as facts. Healthcare is inequitable. We know that. We know that health inequities stand in the way of affordability, health, and well-being, and that we're in a situation in which health disparities account for about $42 billion in lost productivity per year. And when we think about differences among the populations, Black adults across the U.S. die from treatable conditions at significantly 2 times the rate of white adults. And within the same hospitals, Black and Latinx Hispanic patients are more likely than white patients to experience severe complications related to birth, regardless of insurance status. And then we also know that a lack of cultural competence is leading to adverse outcomes and experiences in healthcare. When we look at our non-English speaking population who need an interpreter during a healthcare visit, less than half of them report that they usually always have one. Black Americans, Latinx, and Asian Americans are more likely to report that they believe that they would have received better care if they had been of a different race or ethnicity. And then people with low health literacy skills use more health services with an estimated cost of $32 to $58 billion in additional healthcare expenditure. So when we talk about the inequity, we also can talk about the fact that this is costing the American healthcare system a lot of money. So when we look at today's rate, where the cost of inequities cost about $320 billion. And if we do nothing to stop that, it's expected that in 2040, the cost of healthcare inequities will be at $1 trillion. So we have a situation on our hands, and we have many different solutions, many different potential issues, but I think cultural responsiveness is one of our solutions. But we can't talk about cultural responsiveness without talking about the complex nature of culture. So do we remember what the definition of culture was? If you can just drop it in the chat if anyone remembers what the definition of culture is. Okay, I'll remind you. So the definition of culture is its integrated patterns of human behavior that include the language, thought, communications, actions, customs, beliefs, values, and institutions of racial, ethnic, religious, or social groups. So when we think about what that really means in life, it means that culture can dictate a lot of things. It can dictate how we define disease or illness. It can dictate the beliefs about disease causation. It can dictate why diseases are stigmatized and which ones are stigmatized. It can dictate health promotion activities that are engaged in. And it can also dictate experience and expression of pain, who one seeks out for advice on health, how treatment options are perceived, understood, and followed, and ultimately, our healthcare experience. So typically, when we're thinking about culture, we're thinking about religion, ethnicity, race, national origin, sex. But it can also be someone's age, their literacy level, their educational achievement status, their mobility, and their previous experiences within the healthcare system. So the solution to all of this is culturally responsive care, or CRC. CRC is the intentional and consistent decision health care providers make to see, respect, and celebrate the aspects that make each person unique. It's an acknowledgement of their intersectional existence in the world and how this shapes their experience. Culturally responsive care is built on the idea of understanding and respecting people's differences when determining proper care and providing the best treatment. When people are valued and seen for all aspects of their identity, background, and experiences, they feel understood, valued, and are more able to participate in their healthcare journey in a positive manner. This idea of culturally responsive care is important and refers to respecting the differences and specific health needs of historically excluded communities, including Black, Indigenous, lesbian, gay, transgender, queer, and other historically excluded communities. Only when healthcare providers spend time getting to know all aspects of their patient's life through discussions and active listening are they able to understand and ultimately deliver the appropriate care required. Culturally responsive care enables providers to open the doors to the roadblocks and historic disparities that keep some people from accessing important healthcare. And to highlight the fact that culturally responsive care is not just something that is good for everyone and it's good for the ultimate care of patients, but it also can have a financial return on investment. So a 2020 study showed that culturally responsive care and cultural competence had a potential financial return on investment of $2.47 for every dollar invested. So that's in addition to improvements in quality of care and chronic disease management. So when we think about cultural responsiveness, it's in a paradigm or a framework that encompasses cultural awareness, cultural competence, and cross-cultural skills. So a new term for us today is cultural awareness. Cultural awareness is when a healthcare provider evaluates who they are in relation to their patient. An aspect of cultural awareness is humility, which we define, or willingness to engage in the constant work of introspection and actively addressing inherent power differences in the patient-provider relationship. Cultural competence, which we talked about before, is a set of congruent behaviors, attitudes, and policies that come together in a system, agency, or among professionals that enables effective work in cross-cultural situations. Cultural competency has two dimensions: cultural knowledge, or learning about other communities through books, articles, training, and other resources, and also cultural attunement, which is using curiosity and empathy to better understand patient experiences. Cross-cultural skills are based on the awareness and knowledge providers adapt their clinical interventions to best serve the individual patient. Together, cultural awareness, cultural competence, and cross-cultural skills result in culturally responsive care, or CRC, or care that is going a step beyond knowledge and is actively translating into the care provided. So let's look at an example of culturally responsive care. This is a hypothetical situation, but one that highlights the differences in culturally responsive care and non-culturally responsive care. So Jim is a new patient seeking care for a chronic cough and heavy drinking. In the appointment, he has also disclosed that he is gay and that his family has not been supportive. His physician, who is trained in culturally responsive care, wanted to avoid making assumptions about Jim's needs and asked several questions about how he identifies and his goals for the visit. At Jim's request, they addressed his heavy drinking first and the chronic cough second. In the end, Jim's physician provided him with a referral to a therapist, resources for community groups, and an antibiotic for the cough. So in the chat, please list any ways in which that highlight culturally responsive care or ways in which you think that this is different from a normal patient visit. So the doctor let the patient set the priorities of his visit, yes. And then addressing patient's needs, asking Jim what's most important for him, yep. The provider asked about the patient's need instead of making an assumption, exactly. Not making assumptions, exactly. Beginning by asking how he identifies and what goals he wanted for the visit. Yeah. So this is our example. This is our gold standard. And you might be asking, okay, so why is this not happening all the time? Well, there are a lot of challenges for healthcare providers when we think about what you have in front of you when you're seeing patients. You have limited access to knowledge of cross-cultural awareness or communication, limited access to translators, limited access to culturally congruent specialists and or care coordination staff. There are different expectations from patients regarding healthcare. The approach to medicine and healthcare is from your own perspective and traditional education model. Medicine is steeped in the Western individualist culture, which can be at odds to other more collectivist cultures. Personal implicit biases, explicit bias in healthcare, limited time and resources for holistic intervention. And I see that others are adding that limited time is a big one. Yes, healthcare visits are often rushed. Yes. So it's not an easy fix when we're talking about culturally responsive care. We're talking about something that has to be done at every visit, that has to be taken into consideration, and that has to be something that you are constantly thinking of and working towards. So the next question is, where do you start? So I always like to come back to key concepts of behavior change and levels of impact, because if you're here today, hopefully you're in the model of behavior change in which you're contemplating or preparing to do some action. You are thinking, well, maybe I have the resources available to provide more culturally responsive care, and I'm wondering, what do I do next? And then I'm potentially going to be in an action or a maintenance phase. There are also different levels of impact in which you can have individual impact, interpersonal impact, or institutional impact. So all of these together help to understand and define where we are and what we can be doing in order to move forward with culturally responsive care. So the first things that are important in culturally responsive care is to know your patient population. You want to know what cultures are represented in your patient population, what values, beliefs, traditions, in particular to the cultures in the population, and then who are the gatekeepers of health within this culture, within these cultures, and then what is the culture's perception of health and illness. So knowing the patient population is something that can be done through patient surveys. It can be done through talking to patients and asking them how they identify, what is important to them when they're seeking care, but it's going to require that extra time. So I understand that time is limited and the patients and the visits are often rushed, but these are things that potentially could be worked on in new patient visits and then documented in the chart to follow up through to next visits, or it can be something that is done in a survey to patients at off times. It doesn't have to be with a visit. It could be something that potentially is sent out through the patient portal to ask patients to answer a couple of questions about their beliefs, their culture, and their traditions so that you're able to meet them where they are. So when you're thinking about promoting culturally responsive care, it's important to respect each client's individual experience, each patient's individual experience. Also, recruiting diverse staff. Many patients want to see people who look like them and may have shared the same experiences as them. There's also the need to provide interpreter services at every point of care for patients whose preferred language is not English. This is an important one because if you remember the statistic that I shared prior, not everyone is getting the interpreter services that they need at every visit. So being able to provide an interpreter for patients whose preferred language is not English will help to go past any barriers that potentially might be there due to language. Also, partnering with the community. The best way to build patient trust is for providers to be closely involved in the communities that they serve and that they work. So this could look like employing community health workers. It could look like just being invested in knowing what community resources are available, knowing what community groups are available, and being able to know what potential services are available for patients that potentially are experiencing disconnects, that are potentially at odds with their families, like our example with Jem, or that potentially are having social determinants of health needs. And then also to promote culturally responsive care is to offer lay education on positive health practices. So we don't want to be offering education that is so disparate and that is so technical that the average person can't understand it or doesn't read it. If we're offering things that are typically at a 5th grade reading level, then you're going to be more likely to be able to address issues of health literacy and to help people understand what you're asking for them when you're giving prescriptions or giving points of delivery and points of care in which you're asking for certain aspects to be followed. Lastly, listening and learning. So empathy is a big thing with culturally responsive care, and without active listening and learning about cultures, you're unable to provide culturally responsive care. So then there are 5 recommended activities for all staff. So completing health equity training. So linked here, I have some health equity trainings that are available through the Care First website. They're available to all providers. We have trainings that are available that talk about implicit bias, that talk about cultural competence and structural competence, that do a preview and just really dive into the data about Maryland, DC, and Virginia. And then also one that talks about LGBTQ cultural competence. So I say that completing a health equity training is part of the preparation phase because that's helping prepare you to understand different cultures, to understand implicit biases, and to potentially understand a little bit more about structural competence and cultural competence, as those are areas in which it's important to move forward and to be able to continuously learn. And then also in the preparation phase of things is to complete the primary care self-assessment checklist. So this is a checklist that is intended to heighten the awareness and sensitivity of personnel to the importance of cultural and linguistic cultural competence. It's a self-assessment that you can do, that your office can do, and it will give you an idea of where you are and areas to tune in and to refine in order to be able to meet the needs of your patient population. Also in the preparation phase, educate yourself on the cultural experiences and beliefs of your own culture. So I say to educate yourself on your own culture because that's the first step. The first step is to understand who you are, where you are, what potential privileges or existences you have that are different from others, and to understand how your culture plays into your everyday experiences with your patients, with your staff, with your colleagues, and with everyone that you're interacting with on a day-to-day basis. Once you've done this, you can go into the action phase of things. And like I said, create a patient survey that inquires about cultural beliefs, backgrounds, and desires for treatment. And then you can also get to know local cultural support services that are in your area that your patient might benefit from understanding or knowing. All right, so now I just have a couple of polling questions to check for understanding. And if we can pull those up. There are 3 questions. So the first one is, race is a biological system of categorizing humans based on observable physical features or phenotypes, such as skin color and ancestry. Is this true or false? The second one, yes, because race is a social construct, not biological. Yes. Thank you, Heather. Yes, absolutely. And then the second question is, an example of how you can make your office culturally responsive is make all bathrooms gender neutral, ask new patients their preferred language, or practice active listening and empathy, or all of the above. So we have D for all of the above. And then the last one is cultural awareness, cultural competence, and cross-cultural skills are all parts of culturally responsive care. True or false? So I do have time for questions or comments or anything that you all would like to discuss or anything that you want me to go in more detail on. But if not, thank you so much for attending this session about culturally responsive care. And I will pass it over to the team.
Thanks so much, Jasmine. We do have time for questions, so we can stop here. If folks have questions for Jasmine, you can drop them in the chat directly, or you can raise your hand and unmute to ask your question. We'll just give it a couple minutes here to see if folks have any questions.
Thank you, Ms. Leonard. That was very insightful and it was very informative. We have some questions here that I'm going to read out.
Okay.
So the first question, can you provide an example of how cultural responsiveness has positively impacted patient care in your practice?
So I actually am not a physician, but I used to work with practices, and I can say that culturally responsive care for a pediatric population has definitely helped in being able to make patients more able to feel that they can open up about conversations. So during the pandemic of 2020, and when everything was in an uproar around the murder of George Floyd, I had pediatric practices that were having the first time discussions about race. And so they were asking their patients if they have ever felt that they were discriminated against, or if they felt like they potentially were having issues based on their race. And what was found in those offices is that the patients were able to open up and they were able to address not only some of the physical things that were happening, but some of the mental health aspects that were happening to these patients. And so being able to open up yourself to culturally responsive care will allow you to not only make it easier for patients to feel like you're a resource, but also to potentially find underlying conditions or things that are going on with them.
Hey, thank you. The next question. What are some practical steps that healthcare providers can take to continually improve their cultural responsiveness in clinical practice?
Yeah, so I think education is the biggest component in learning about different cultures and being able to provide culturally responsive care. So, everyone has the need to do continuing education credits, and being able to potentially make those credits based in conversations around health equity, conversations around implicit bias, conversations around cultural competence and structural competence. Those are going to be the ways in which you're not only meeting the needs for continuing education, but also that you're meeting the needs to continuously learn about this. This is not something that you wake up one day and all of a sudden your care is culturally responsive. It's something that you have to constantly work at, and something that is going to take that action, that decision-making point to decide to say, okay, I am doing this, I'm learning, I am constantly learning, I'm asking questions, I'm potentially making myself uncomfortable. I think that's a big aspect of this, that sometimes people don't want to be uncomfortable, so they don't ask the question. But if you're able to step outside of yourself and really lean in on that empathy piece, then you're able to go ahead and move forward in culturally responsive care.
Okay, thank you. Then the next question. What metrics or indicators can be used to assess the effectiveness of cultural responsiveness initiatives in healthcare settings?
So one of the great assessments, and I will try and go ahead and after this, I will drop some things in the chat. But there are assessments that can help you determine how culturally responsive your practice is. But then I think the biggest thing is really going to be getting patient feedback and asking the questions of the patient. How do you feel in my care? We talk about CAPS and things like that, but CAPS isn't going to get at the nitty gritty. And the way to really understand that is to be open to patient feedback and to have patient surveys and to just offer time for patients to give you open and honest feedback on how you're doing. And then, like I said, there are assessment tools that are available that can help you self-assess yourself, and that you might be able to use to also ask patients to potentially provide an assessment on as well.
Thank you. And the last question for this section. What are some challenges or barriers in fostering respectful and collaborative relationships with patients from different cultural backgrounds, and how can we overcome them?
Yeah, so some of the barriers I talked about in terms of time and limited resources and limited interpreters and things like that. And so the ways that you can overcome some of those barriers are to put some money into getting staff that is from the area, that is from diverse backgrounds, that are able to speak more than one language, that are from the area in which you're working in. And then being able to potentially, like I said before, taking some time in those new patient visits to really understand the patient and to understand what their backgrounds are and what their culture is. That could also be done through the patient portals or at a different time so that you're not having to spend the valuable one-on-one time that you get with patients, but really just being open and willing to get that information up front so that you're able to move forward and to understand where the patients are coming from. There are lots of barriers, like I said, lots of challenges, but the biggest one is being able to have these conversations and to start the trajectory in which you're asking, okay, how can I do better? And then once you're able to do that, you're able to move forward and then potentially address some of those barriers. And whether it be addressing social determinants of health or addressing different social risk needs that are within the patient population, it's also tapping into some of the billing and the coding so that you're able to get into some of the reimbursement factors in which I mentioned that there is a financial investment, but for every dollar that's invested, there's a potential of $2.47 that come back to you. And that's not addressing the improvements in chronic conditions and the quality of care that patients receive.
Wonderful. Don't think we have any other questions at this time. Looks like several great notes in the chat. Looks like the session was particularly informative and thorough. Thank you so much, Jasmine, as always. Really helpful information. Just one comment I'd like to call out is Christina mentioned that it's a good topic for a PFAC meeting. That's a great note. Thank you, Christina. With that, I will say again, thank you so much.